Good morning, everybody, and thank you for coming to our Lunch and Learn for Sun Safety. We are providing this, we got an award back in the fall time, and we're going to be doing a lot of different things with cancer prevention and action, and Ginger and Vicki. So thank you again for coming, and I will turn it over to them.
Hi, everybody. Thank you very much for your time today. We appreciate all of you, and I've got some folders here that I want to pass out to everybody. If we could just take a look at what's in here. There's some more documents and resources in those for you. Thank you, Gary. Appreciate that. So, Take Action Against Cancer. What we try to do in our program is create and drive a PSE change. We are contractors with the New York State Department of Health. We sit under the Bureau of Cancer Prevention and Control. We also are active on the New York State Cancer Consortium, trying to learn the different methods and strategies that are latest with all the science that's coming in to really roll out to our communities. And one of them is a PSE change, policy, systems, and environmental change. Now, is anybody familiar with that terminology, PSE change? Okay, so I just want to explain that piece a little bit more. So we work in Fulton, Montgomery, and Schenectady counties. Our catchment population is 268,000 people that we try to reduce cancer onsets for by promoting these policy systems and environmental changes. So let me give you an example of one that actually drove a social norm and is widely accepted. So in 1973, there was a federal law that was implemented that greatly reduced fire-related injuries and fire-related deaths. It currently exists in this room today and has saved a lot of lives and health outcomes. Does anybody have any idea what it could be?
Life is exercise.
No. It's close. It's a close one, but it's widely accepted. It's a social norm. Any other ideas? What's that? No. It greatly reduced fire-related injury and fire-related death. The smoke detector. The smoke detector. Okay. Before 1973, that was not a law. So a lot of, structures, and there was a lot of smoke damage, there was a lot of injuries, and a lot of deaths. That actually drove this policy change, which changed a system, built a new environment, and is now widely accepted as a social norm. So that's what we're trying to do today with some of these simple strategies, and we'll get into a little bit more of them as we go. Does anybody have any questions about what a policy system and environmental change is? Okay. You can go to the next slide. Okay. Oh. Hi there. Come on in. So a little data about cancer in general. Cancer is the second leading cause of death in the United States. And 120,000 New Yorkers will learn that they have cancer this year. But about 42% of those cancer cases from this year could have been prevented. Now, there is a public database that's available on the New York State Department of Health website, and that shows the cancer incident and mortality for Montgomery County. That is a link if anybody's interested. You can go right to that, and it gives you the latest information. And when we look at cancer, the definition is abnormal cells that grow out of control and they form masses known as tumors. And what we're trying to do is prevent that cell from growing abnormally as much as we can. So what can we do to protect the cells? What can we do to shield those cells or keep them from growing out of control? So we'd like to advise people of what your risk factors are and then what you can do in your prevention efforts to take action against cancer. So some simple risk factors: age, race, family history, your first generation, a parent or a sibling. If they've had cancer, that does put you at a higher risk. There's genetics. You can do genetic testing right now for cancer, but genetics meaning the DNA that carries instructions to make protein or several protein that can change and form variants, mutations, or alterations in the cellular forms. If you have an immune system that's compromised from an organ transplant or HIV patients or a cancer patient, you're at a higher risk. Cancer-causing substances in the environment, asbestos, formaldehyde, and radon. My background is laboratory services through the American Society of Clinical Pathology, and I used to work with formaldehyde for a long period of time, in which we would actually preserve the tissues that were coming out of surgeries. You have to handle that type of substance very carefully, and you have to stay up to date on the latest trends and therapies in handling that kind of stuff. So make sure that you always have education and you're reading up on things like that. Can you go to the next slide? Hormone therapy is a risk factor towards cancer, and that includes oral contraceptives or menopausal therapies. There are some infectious agents from viruses or bacteria illnesses that can be risk factors towards cancer, and that includes exposure to Epstein-Barr virus, which can drive lymphoma if it's not addressed or if it's recurring. Hepatitis B or hepatitis C virus can cause liver cancer if it's not addressed or if it's recurring. And then there's the HPV virus, human papilloma virus. That can cause 6 different cancers if it's gone untreated or if it's recurring later. The H. pylori bacteria virus, our illness also is the same. It can cause gastric or stomach cancers. Another risk factor towards cancer, it could be your lifestyle behavior. Alcohol consumption, smoking is a big factor towards cancer. UV exposure, we're going to get into a lot of depth on this one, but UV exposure is a risk factor towards cancer. And then, of course, obesity. You can go. Okay, so some of the actions that Montgomery County has taken in the beginning of the year is your paid time off benefit for cancer screening. Are you familiar with the civil service law through New York State, where if you follow civil service guidelines, you're afforded 4 hours of paid time off per calendar year without any credits taken away from your personal vacation time, anything like that. You're all familiar with that. Montgomery County has expanded it and is now giving you 2 4-hour banks of time. So all total, you have 8 hours to get a cancer screening. This is a driver to reduce cancer. This is a very big asset to all of you, and I highly recommend that you use that. You can go right to the next slide. So cancer screenings, 1 out of 5 deaths in New York is due to cancer, and your health is a priority, especially to leadership and the executive leadership here at Montgomery County. Some cancers can be found early or prevented through screening tests. Screenings can find these cancers early when they may be easiest to treat, or for some cancers before they can even start. You can actually capture precancerous cells. So early detection of breast, cervical, colon, lung, prostate, and skin cancer can dramatically improve treatment outcomes and save lives. The reason that I pointed these particular cancers out is because the U.S. Preventative Services Task Force, or the USPSTF, determines the criteria for cancer screening exams, and they have oversight with all of the medical insurance companies as to which tests are approved and can be rolled out. So these are the tests right now that are available for cancer screenings. CPIA advises you to talk to your healthcare provider every year about what cancer screenings are best for you. So let's think about this. Your employer is giving you 8 hours of time. You have a well visit or a primary care office visit. You go to that doctor. You show your doctor some vulnerabilities and talk to them honestly, an open conversation about how you're feeling, and then they'll determine what cancer screenings you need to have, and you can set up a plan of action as to when you need to be tested, how often you need to be tested, or if you've had any exposures, and together you can work that out. So I think it's really good that you have this conversation. So Montgomery County has afforded you the 2 4-hour banks. These screenings include physical exams, blood work, skin checks, and other laboratory tests for the detection of cancer. A doctor's note must be provided for each appointment, and this note should be given to the department leaders or timekeepers for the time to be charged out of your PTO bank. You can also get a copy of the policy from Human Resources or your department lead. Does anybody have any questions about the paid time off section before we move forward? Does everybody understand it fully and the benefit for it? So I have to tell you, in Montgomery County, this is an outstanding benefit, and there's not a lot of employers in this region that have this benefit for 8 hours. So congratulations to you and your teams, and I really hope that you can optimize it. All right, we can go right next to the slide. So this is about the screenings themselves, and these are the recommendations from the USPSTF. For women, for breast cancer, you want to look at ages 40 to 49, and you can have a conversation with your doctor as to how often. For women ages 40 to 74 years old, average risk for breast cancer, the mammogram is recommended every 2 years, but have that conversation with your doctor, because your doctor may want you to have it done on a yearly basis, but that's for you and him to decide, or her to decide together. The USPSTF advises women between the ages of 21 to 65 to have who have not had or have had the HPV vaccine to get cervical cancer screenings done. And then for colon cancer, this was recently lowered. The recommendation was 50, and it's now 45. So 45 to 75, you should consider colon cancer screening tests. And there are multiple tests. It's not just a colonoscopy, but once again, you can decide that what fits best for your lifestyle with your doctor. So lung cancer screenings. Has anybody heard of a lung cancer screening exam? It's kind of new. It's recently come out, and it's a low-dose computed tomography or a low-dose CAT scan, and it's for adults ages 50 to 80 who have a 20-pack year smoking history and currently smoke or have quit within the past 15 years. So once again, have that conversation with your provider. But lung cancer is the #1 cancer killer for both men and women. This is a very hard disease to capture and then to treat. So make sure that you have the conversation if you feel that you're at risk. And then for the prostate cancer, so a prostate-specific antigen or a PSA blood test is the recommendation now, and it's for men ages 55 to 69. And once again, have that conversation with your provider. And then for skin cancer, the USPSTF advises visual self-exam by the patient and a clinical exam by a healthcare provider that could be used to screen for skin cancer. And regular skin checks by a doctor are important for people who already have a skin cancer diagnosis. And we're going to get into that a little bit more. But does anybody have any questions about the recommended screening tests that are available? I just want to make sure that we're sharing the latest in technologies and the screenings that are have oversight from regulatory agencies. You want to make sure that you're really doing your due diligence and you're using those types of exams. Okay, we can go to the next slide. So sun safety. So for sun safety, I'm going to have Vicki come on up, and she's going to share some education about the new sun safety policy that has gone into play for outdoor workers.
Hello, I'm Vicki. Sun safety education is a big part of this because it is so important. There's a lot of thought that went into the award towards the sun safety piece. UV radiation, there's 3 different types of UV radiation: UVA, UVB, and UVC. UVA causes aging, wrinkling, skin cancer. It also penetrates the deepest into the layers of your skin. It can pass through glass, it can pass through windows, and it is prevalent all through the year. So it's not just a summertime thing to worry about. UVB causes your sunburns, your skin cancer. It penetrates only to the outer layer of skin, and it's strongest in the spring through the fall and from 10 a.m. to 4 p.m., but it is all day long is something you have to worry about. Skin cancer. 1 in 5 Americans will get skin cancer in their lifetime. 1 in 5. Skin cancer is the most common cancer. Ultraviolet UV radiation is a risk factor. Basal, squamous cell, and melanoma are the 3 types of skin cancer. And squamous cell is sometimes pronounced differently, but those are your 3 types. Melanoma is your deadliest. Tan skin is damaged skin. If there's tanning involved from a sunburn or anything else, that's damage that has been caused. Men are more likely than women to get skin cancer because they're more likely to work outdoors. Don't sunburn. 1 blistering sunburn over your lifetime can more than double your risk of skin cancer. Just 1 sunburn can double your risk. UV radiation can penetrate clouds, light clothing, windows and windshields. For example, have you heard of trucker's arm? They're getting a lot more exposure on that arm over a long period of time. UV radiation is 4 times stronger if you're on a reflective surface, such as blacktop, concrete, metal, such as roofing, sand, or when you're in the water. Skin damage from UV exposure adds up over time, increasing the risk of getting skin cancer as we age. And that's one reason that a risk factor for cancer is age. This is a UV index. The UV index can tell you exactly how dangerous it is and how quickly you can get those sunburns. You can find the UVX on a daily basis, news outlets, online. Things to prevent skin damage is always important, but your UV index can give you an indicator of how long you have before it's really a danger. Taking action against skin cancer while you work. Schedule outdoor work tasks around the UV index if possible. Share the UV index with your teams. If you're a leader of a team that has work going on or something going on outside, make sure that you know that UV index and that you share it with those teams. Increase your shade. Excuse me. Identify locations at outdoor work assignment locations to use shade. Anything that you can do on an outside work, try to do it in the shade. Provide portable shade at work sites using Easy Up tents for mobile units also. Providing Easy Up tents for tabletop outdoor work assignments or long emergency calls or trainings. Use umbrellas and open seat equipment, such as a cat umbrella when you have gentlemen out working using the pavers and such like that. You want to have them enclosed or in shade. Provide portable shade at long duration emergency calls. Take breaks in outdoor shaded areas whenever possible. And that's something else that's part of the award that Ginger will discuss. More things you can do to take action is apply SPF 15 or higher to all exposed areas of your skin. Does anyone know what SPF stands for? Sun protection factor. That's why the higher numbers are more important. Say if you're in the swimming pool, 15 might be okay for your hands, but you might want to think about a higher level for your face because it's reflecting off the water into your face. A palm-sized amount and reapply every 2 hours. You want to make sure you have a good coverage because you have your pores, your crevices in your skin. You want to make sure that they're really covered well. Have sunscreen or towelettes available for mobile units, equipment trucks, toolboxes, patrol vehicles. Be mindful again of reflective surfaces if you're on the asphalt, concrete, metal, sand, or water. Wash your hands after you apply the sunscreen and before handling food, power tools, or weapons. One of the things, take action that you can do when you work. Increase your personal protective equipment clothing. Cover up. Me personally, I would rather wear something long sleeved than have to worry about a time frame for sunscreen. Wear wide brimmed hats, back of your neck coverage, full face gaiters, neck gaiters, long sleeves. There's UV sleeves, long pants. Anything you do to cover up is less that you have to worry about. Finally, last action you can take is wearing sunglasses, and make sure that they have UVA and UVB protection. Not all sunglasses do. The majority of them do, but don't assume. You want to make sure. They can protect you from eye cancer, cataracts, having sunburned eyes, and growths on or near your eyes. And the instances of cataracts in younger people is rising, and it is due directly to UV damage. All right.
Well, thank you, Vicki. Okay, so Montgomery County has implemented these policies. So for sun safety, to have some encouragement towards these strategies. And with that, Cancer Prevention in Action is going to help support this implementation. So I just want to go over what the award is going to look like and how it can be utilized. So first of all, we have hired a media production company, and they're going to be coming in and they're going to be creating some video assets. So we're really super excited about that. That's going to be starting pretty soon. All of our lunch and learn sessions have also been included. And then for every county office building, so this is going to be the annex building, the county office building, the DPW garage, the new courthouse, the old courthouse, Amsterdam DSS satellite office to be moved to Venner Road, the public safety building, and the sanitary district number 1. Everybody is going to be receiving a sunscreen dispenser. It looks just like this, and the dispenser is going to be mounted to the wall, so you have access to sunscreen on a regular basis, and there's also a year's supply of sunscreen that comes with it. And we're using the SPF 30 because it's a little bit stronger grade and it's protect your skin a little bit longer. And then you're also going to be receiving a set of these 3 shade sails. Has anybody seen the shade sails in any of the City of Amsterdam parks? So in Riverlink Park, there's some that is directly over the playground and some of the play equipment. And these shade sails are gonna be available to you guys, so you have an increased area for breaks, so you can go outside and not be exposed. So we're really excited about that you'll have an increase of shade. So that is gonna be implemented within the next couple of weeks. There's also going to be 20 of these boxes. Now, Montgomery County has all of this already. Missy and Nicole are gonna be distributing this out to everybody. But this is the portable sunscreen that we were talking about for all the mobile units. It could be for the patrol units, it could be for the DPW teams or the highway teams. And what this is, it's an SPF 30 sunscreen sample and then a towelette so you can wash your hands right away. Because when you're on the road, you don't have access to a sink to use soap and water, so you can wash your hands after applying the sunscreen, because sometimes that can get slippery. You don't want to be using power tools right after you apply sunscreen. And then we've got a whole bunch of these hats that went out to the landscapers. We did a session with them yesterday, and they were all super appreciative to have this to help protect their skin a little bit more. Because, I mean, let's be real, too. When you get burnt, it hurts, right? They don't want to have to feel that anymore. So this is coming out as well. So these were purchased for all of the deputies. This is a recommendation from the Skin Cancer Foundation. And these are what the pro athletes use to protect their skin. They're called UV sleeves. Has anybody ever seen them before? Yeah. So they're really good, and they can protect for a long period of time, where if you're on the road and you're mobile, you don't have to worry about reapplying sunscreen. It can be a little bit challenging to watch that time. You know, it's been 2 hours since I put it on. You might not have that availability, so we wanted to give options. So you have this as an option as well. Sunglasses were also given. Sunglasses, these are for the work site as well, and they are ANSI certified, which I believe means it's a protective glass, which everybody needs. There's also UV sleeves for the DPW and the highway crew, as well as gaiters for their neck, and then some different styles hats to keep them safe. So we're really excited about all of that. That all rolls out. There is, Vicki had mentioned before, a cat umbrella. It's a Caterpillar umbrella that will go on some of the equipment. That has also been purchased. And Eric and his team are gonna install that. There was 2 portable custom tents, one for the sheriff's office and then one for Montgomery County Public Health. Those departments were identified because of their high community engagement. So those custom tents are all lettered up, and there's a back wall to help increase shade, especially for activities like Youth Day, things like that. So that'll really help give you some extra coverage. And then there's also 10 portable Easy Up tents from box stores that were purchased, and they've also been distributed. And this can go out to all the different departments. They have a dual purpose. So if you're on the road, they can be used for long duration calls. They could be used for training activities and really help increase the shade when possible. They can also be used if there's any sort of emergency calls where there may be a fatality, and you can use that to help shield the victim, to give some dignity to that scene. But there's a lot of purposes for them, so we want to make sure that everybody has them. And then I think the last piece was the signage. So a lot more signage you're gonna see. And then I think you guys have all your folders there. So we're really excited about this collaboration. You can go right to the next slide. So you're taking actions against cancer. You've got an expanded paid time off for cancer screening. So talk to your doctor. You've got a sun safety policy now for when you're outdoors. And make sure that you're reviewing the communications that are coming out from Missy and the team, because there's lots of those that you're going to see, especially on Wellness Wednesdays. And you may have received some postcards already. That's a whole line that we created that's going to be rolling out throughout the year to just give those reminders. But we do have a website, takeactionagainstcancer.com. We have a Facebook page. If you have any questions, that's my office line. You can contact me anytime, or Human Resources. Does anybody have any questions? Because we're here for you. We're a resource for you. We're here for the long haul. Okay, so in your folders, if you don't mind, there is a small evaluation we would like you to fill out, and that goes back to the Department of Health. And then on your way out, everybody can help yourself to a box lunch. And Missy's gonna call a winner for their
Before we draw for